the years, strikes and counter-strikes have visited untold hardship and financial distress on many people. Some have been forced away from public hospitals to seek medical attention in privately owned institutions where fees are much higher. Those who are financially more buoyant have resorted to seeking treatment outside the shores of the country. The objective of this forum is to give a better orientation to the new technical team inaugurated to drive Imo State's primary healthcare delivery system. Primary healthcare workers as well as medical practitioners are being retrained by the National Primary Healthcare Development Agency in collaboration with the Johns Hopkins International Vaccine Access Center towards implementing the federal government's new policy on primary healthcare under one roof.
I know that this workshop will enable the members understand their roles and responsibilities in the newly established Imo State Primary Healthcare Development Agency.
An executive member of the Imo State Primary Healthcare Development Agency is optimistic that all issues associated with the state's primary healthcare delivery system will be sorted out.
There were some levels of decay and then inefficiency, dilapidation, and then poor linkage between the community and the facilities that the service. So that is why this revitalization and reformation is taking place to reposition the primary healthcare to function optimally.
However, healthcare development partners in the state are seeking the participation of various communities to ensure that the healthcare delivery system is properly maintained.
In a primary healthcare system, before you would have people who work in the PHC system being employed by different agencies. At the local government level, the health workers would be employed by the local government, the doctors would be employed by the state government. So it made it very difficult to coordinate and ensure accountability. This reform, therefore, now creates a state level agency that manages everything that has to do with primary healthcare. So it's one management, it's one funding source, it's one evaluation and one planning system.
Nevertheless, the Imo State government says it remains committed to the people's healthcare needs.
If there's anything that bothers the present administration in Imo State, it is that of giving quality healthcare delivery to the people of Imo State, especially those at the rural areas who are there to access the primary healthcare in their various localities. So with this training, like I said earlier, every participant will know his or her role towards giving this quality healthcare delivery at the rural areas.
The primary healthcare system is designed to cater for Nigerians who seek first-level healthcare services. The healthcare under one roof was set up to improve on the existing structure by providing universal coverage in all centers across the country. Salary scales and remuneration of services is where physicians and other medical workers have differences in opinion.
There is something known as relativity all over the world, not in Nigeria now. And that relativity simply means that if a doctor is being paid X amount of salary, or for example, no, let me even start with, if a pharmacist is being paid X amount of salary, a doctor should be paid X times a percentage or a ratio. That is the general principle all over the world. And subsequently, so normally the highest paid are usually the doctors, followed by the pharmacists, and this, and then you could have nurses, and then the laboratory scientists, and then downwards. And this was not just gotten out of thin air. It was gotten based on certain principles. Again, the number of years spent undergoing training. Number two, the content of what you're training.
Under relativity, we have people who studied for 7 years. We have people who studied for 6 years. We have those who studied for 4 years. Each have their entry points. They carved out, government allowed the carving out of different salary structures. These different salary structures will bring about different demands. What we are saying is this: if the salary structures have taken care of relativity, 1 year difference, yes, obviously something must be added. You must have something above the man that comes in with 6 years. 6 years must have something above somebody that comes in 5 or 4 years. But what we are saying is, if there's something that is to be done for the health sector, it should not be done only for one profession. It should spread across health sector. Salary adjustment was done for them. In the same vein, it's supposed to have been done also for the other health workers.
One of the most important aspects that causes this conflict between doctors and other healthcare workers is basically two things. One, issue of remuneration, and two, issue of administration, that is headship and of the hospital. So the other medical personnel say, why can't they also head the hospital or be the leader and all those things? Well, they have their point, but as it is today, there are law establishing the hospitals and other centers, and those law talks about medically qualified. Now, in a recent ruling, it was clearly stated that medically qualified means somebody who is a doctor who is registered with Medical and Dental Council of Nigeria.
Things were relatively peaceful everywhere, except in the Federal Medical Center in Owerri, the Imo State capital, where a long drawn-out battle ensued and is not quite over. The trouble centered on allegations leveled against the medical director of the institution, Dr. Angela Uwakwem, who was accused of corruption and high-handedness. Dr. Uwakwem was suspended in order to enable authorities investigate the claims. The federal government recalled the FMC medical director after 10 months, stating that she may not have any case to answer. But the joint health sector unions would have none of it and took to the streets again in protest of what they called obstruction of the rule of law.
They should do the needful. They should actually go back and see those allegations and look at them. If she is worth coming back, then we will know. But I don't think she is free to come back. So we still stand by what we stand by. We don't want her and we don't want her.
So bitter was the rancor that it forced together authorities in the state, including the State Commissioner for Health and the chairman of the Owerri Council of Traditional Rulers, who appealed to the striking unions to let peace reign and return to work. Meanwhile, the lady in the middle of it all has resumed office, promising better healthcare service delivery to the people of Imo State and beyond. She is also waving the olive branch.
We want to recognize the fact that we did not serve them optimally. Regardless of the peace that may or may not have been found, the factor is that we did not optimize our care. And that is the basis of my apologizing as of courtesy to the members of the public.
The healthcare workers, however, are adamant in their protest, while doctors do their best to maintain services in the hospital. Meanwhile, residents in the state have had enough of the standoff and have taken to the streets to state their position. President Muhammadu Buhari, in his 2017 budget speech tagged the Budget of Recovery and Growth, said implementation was hampered by relatively low oil prices in the first quarter of 2016 and promised to prioritize health in the next budget. He has proposed 252.87 billion naira under recurrent expenditure to cover payment of salaries and overheads. This is up from 221.7 billion naira in the 2016 budget. Under capital expenditure, he has proposed 51 billion naira for the sector. The question is, with the current cost of services, Will this make the difference needed in the health sector? That has been the big story. Thanks for watching. I am Mary Alale Yusuf.